One of America's biggest pharmacy chains has kicked its tobacco habit. CVS will phase out cigarettes, cigars and chewing tobacco by October the 1st. The CEO Larry Merlo says the company decided it can no longer sell cigarettes at places where it also provides healthcare. Let's go to Shihab Rattansi, who's live for us in Washington. What's been the response there, Shihab?
Well, as you might expect, welcome from anti-tobacco activists, a welcome from the White House as well. But you've got to remember, this is a very sober cost-benefit analysis decision. You've also got to put it into the perspective of where cigarettes are sold in the US. Less than 5% of cigarette sales in the US are at pharmacies, and it makes a very minuscule part of CVS's sales. In the end, this is, as the CEO of CVS himself said, about where they think their money lies in the future. The for-profit healthcare industry in the US, well, there's billions of dollars. Here, that's where they want to make their money. And it simply doesn't look good to be selling cigarettes in the front of your stores and then making billions of dollars treating the effects of those cigarettes in the back of your stores. They also have an eye to Obamacare, the introduction of medical insurance to those who were once uninsured. There's a huge shortage of doctors in the US. So CVS, with its in-store doctors' surgeries, they want to take a big chunk of that money as well. So there's a lot of money to be made, and obviously selling cigarettes doesn't make you a credible player in the healthcare marketplace and convince people that you're part of the solution to healthcare costs and not part of the problem.
And obviously it's a nod to how dangerous smoking is for you. How big a problem is it in the States?
It's the largest cause of preventable death in the US. Some 460,000 people a year are dying from tobacco-related diseases. The number of smokers in the US has dropped since 1970, when it was about 40% of the population, but the number has held steady since about 2003. 17% or 18% of the population still smoke. Activists and campaigners have long said we've got to try and stigmatize smoking, we've got to prevent access to smoking in stores and so on. But they also say the government needs to show more leadership. President Obama welcoming this move by CVS. But activists say the FDA, the Food and Drug Administration, missed its own self-imposed deadline for tougher regulation on tobacco at the end of last year. The Obama administration watered down tough regulations on countries' ability to have stringent tobacco regulations and protect them from lawsuits from tobacco companies as part of their negotiations of the Trade-Pacific Partnership deal, the trade deal that's currently underway. It's the usual story in Washington. There's a huge tobacco lobby. There's billions of dollars, and then there's health. So, you know, there we are.
Okay, Shihab, thank you for that.